Hi, I'm Dan Smith. I've got my colleague Scott Cook here today. Hello. So we are going to talk today about pain, in particular chronic pain and sensitivity. We see many patients coming through our doors on a weekly basis that have had pain for several weeks, months, if not years, and struggling to feel better, struggling to get over their pain and get back to some kind of normality. So we thought today we'd have quite an informal chat about the scenario and the kind of the science behind chronic pain and sensitivity. So Scott, we're going to talk today, I think, first of all about the physical side of that contributes towards pain. So I've got this over this side on the whiteboard here. Scott, can you tell me a bit more about the physical contributing factors to pain and sensitivity?
I think the first thing to point out is that this is often the main reason why people come into clinic. So they're in pain, and we often associate that pain or that painful experience with physical things. So doing something, bending down, sleeping funny, lifting something in the gym and doing something physical. And I think it's really important to recognise the different factors which sit within that physical entity. And how they may be contributing to your pain, your injury, and why you're maybe not getting better. I think we break it up into two parts on here, looking at biomechanics, so looking at how you move, your coordination and control of movement, and amongst other things, which we'll talk about in a bit more detail. And then load, so looking at how much you do and how much you're doing is affecting your body. So starting off with biomechanics, I think it's first pointing out that there isn't one correct way to move. There's lots of different ways to move, and I think we kind of pigeonhole people and pigeonhole patients sometimes by going, right, this is how you should do things, this is how you should sit, this is how you should bend. And actually I don't think that is a really up-to-date way of thinking, and I think we need to be exploring more about movement variability. What do you think about movement variability?
I think historically people have been told that they have to bend their knees when they pick an object up, or they have to keep their spine nice and straight when they're sitting, when quite often this isn't the case. Everyone moves differently. You only have to look at children to see that they all have these different options in how they get from A to B. A child won't sit in one way at school, they'll cross their legs one way, cross it the other, they'll slump this way, slump that way. So I think we need to move away from this normal movement and look at variable ways of moving and getting from A to B.
Yeah, and I think one of the things that's really worth pointing out with variability in movement is going back to children, they move in an array of different ways quite comfortably. And then as we get older, generally because of lifestyle factors like our work and the repetitive nature of what we do, whether that is life, sport, we find ways of moving that we tend to do repetitively. And then we lose those other options that we potentially used to have. And then when you go and ask someone to move in a way that they may be not used to, they find that very challenging, and their body's not used to it. And that means that their movement options have become very narrow, and that often is a contributing factor to why they might get pain and injury or repetitive stress being placed on those tissues and on those areas of the body that they normally work.
And I think what we'd find with those type of patients is they might start to get a bit stiff in a certain body part because they're not using that certain body part, and this stiffness then leads them to stress and strain other parts of the body, and then get pain. They might get some degenerative change, so arthritic change or tendon change, and that becomes painful, and they continue to move in the same ways rather than actually exploring different ways to move, but getting rid of their stiffness and finding ways they haven't moved in for some time that would actually help to alleviate their symptoms.
Along with what we just spoke about variability, I think it's also mentioned about kind of strength and flexibility, and I think that these can both be a predisposing factor to why you might get pain, but they also can be an effect of pain in the first place as well. So they can be a protective response that the brain goes into. We know that pain inhibits your body's ability to be able to strengthen. So actually by being in pain for a long period of time, you can decondition. And I think if we look at historically how we've approached treating patients in pain, it's been very passive. It's very much around massage and acupuncture and manipulation and that kind of work, which while that might be useful with kind of mediating or alleviating patient symptoms in the short term, it certainly isn't restoring function. it's not going to improve their muscle strength or improve or restore their flexibility, which fundamentally you need in order to be able to move and move without pain. So I think these could be sometimes a cause, but also sometimes an outcome after someone's sustained an injury as well. And these are the things that have to be addressed when looking at people with pain from a physical perspective.
I think you only have to look at the way people move when they're in pain to see that they can quite easily get stuck in those ways of moving, and they can become, which we'll talk about later, fearful of moving in different ways, so they stay in that method of movement, if you like.
Yeah, and I think one of the things with all of these, by changing movement or improving movement or working on your movement, it takes time. So there's no quick fix for this, but there's also longevity to it. So there is sort of sustainability. It's what is going to give you that long-term solution to your problems, as opposed to historically your quick fix, your patch and go. So I think changing our perspective and how we view what we really need to be working on, as opposed to just trying to treat the pain in the short term, is really important. And I think anyone with kind of who's been experiencing pain for a long period of time, so our more chronic pain sufferer, looking at movement and exercise as a means to actually help them move forwards out of that situation is fundamental. And we're no longer looking at the quick fix, we're looking at the long-term approach with those patients.
And we know these changes take a while to take place, don't we? Both at brain level and at physical level. It takes at least 6 weeks for your muscles to start to change when you're exercising. Your brain can change a bit quicker, but again, it needs to learn the way you need to move, and this can take time. Learning the piano doesn't take a couple of weeks. Tell me a bit about loads. Tell me a bit about this section here.
So loads a bit kind of hot topic at the moment. I think a lot of Tim Gabbett's work that's come out about acute chronic workload and how the effect of the load that we place on our body kind of influences maybe pain and injury risk. So load is a mixture of what you're doing, but also how your body's tolerating it. You can do a lot, but your body tolerates it really well, and the human body is able to deal with a lot of load and a lot of stress, providing that it's looked after in the right way. So a lot of this load looks at, right, what are you doing and what do you want to do? And then how is your body geared up to handle what you're placing on it? And for some people, it's a case they might be doing too much and not kind of looking at the recovery element, the health, the conditioning, all the other factors that enable your body to tolerate more, which we'll talk about, things like sleep and other things. Or it might be that they're doing too little. So exercise protects our body. Exercise creates a robust entity that can handle stress. And so some of us are doing too much and we're not looking after ourselves, and some of us are doing too little. And I think looking at what we're doing, the amounts we're doing it, and our approach to what we're doing is really, really important. And we might need to rein some people in, and other people we need to let them go and say, come on, we need you to do more, you need to push your body more. And I think often we are surprised, or we shouldn't be surprised, but we are surprised with how much the human body can actually handle when we approach it in the right way.
I was talking to someone about this yesterday. She was asking me why her arthritis that she's had for many, many years has started to hurt more. And one of the things I said was, well, your arthritis can lay dormant, it can be there, but it's only when you expose that body part to extra stress or strain or load that the arthritis starts to play out. It's just simply, it's not because you've got arthritis, it's because you're overloading that body part and it doesn't like what you're doing to it. So we can find a different way around that, so we can either reduce the type or the amount or the intensity of the load, and we can maybe do that through moving in different ways. So our choices and our variability of movement. I said then there's a good chance the inflammation settles down and you'll go back to your previous state of actually not knowing that you've got an arthritic problem.
I think as well what's really important is once we've reduced load, potentially to allow tissues to settle, we must rebuild. So we have to progressively expose that body part to load again, to condition that and to build that tolerance. And all tissue in the human body, from bone, ligament, tendon, muscle, cartilage, responds to loading, responds to exercise, and that makes that tissue more robust. But when we're in pain, we tend to do less. And if you don't use it, you lose it. And the rate of loss happens rapidly, and it takes a long while to regain that. And I think that kind of dropping back and rebuilding, we just have to be consistent and stick with it and kind of continue with what that you set out in your plan to then enable you to go on and reach your goals. And we often are too quick to go, oh well, I've done that for a few weeks and it's not working. When actually it takes a long time to build up that low tolerance and to build up that robustness.
I know we talk about graded exposure and pacing with our patients. So graded exposure is this gradual, progressive loading of the body part that's been injured so that it doesn't tip it over the edge and make it sore, but it builds that tolerance to it. And then that pacing being taking your time with it, making sure that you plan your movements and your training so that you're giving yourself recovery so you get over it and you don't flare yourself up and make yourself sore.
And just going back to a point while we're thinking about your lady with the arthritic hip, I think, you know, they can lay dormant and then become painful. It often takes something to trigger it. But sometimes it's not necessarily increasing your load above the norm or above your norm. Sometimes it can be where you've dropped off and then you've tried to go back to where you was before.
Yeah.
So, you know, as I said, exercise helps us keep and build that robustness that keeps us at a level that maybe our body's happy with and it's tolerating very well.
And it's typical runners as well, isn't it? When they have a couple of weeks off because they're out injured or they've got flu and they go back and they try and go back in the same level they were at before they got injured or got ill, and they find they succumb to it.
And we'll see a lot of that next year after Christmas.
Yeah.
People have a Christmas break, they either have not trained, they might have put on weight, they've ate a lot over Christmas, they've become more inactive for just a few weeks, maybe a month. You know, and then they'll come back in January and then they'll really kind of pushed in, and a lot of physio, osteopath and kind of chiropractic clinics will be really busy around, you know, end of January, February, March time, because of people have stepped up their load. And it might be from going from a lesser load to what they normally do, or increasing the levels above what they normally do, that will trigger their body to go, whoa, what's this about? And it's not conditioned or ready for it.